Hey everybody, welcome back to the PSMA webinars. Today I'm very excited that we're having Cintas put on this webinar, and they've actually brought in Elias from LKC. They're a consulting group, and Elias will talk about infection prevention and control, past, present, and future. And I think Adam Deas will be speaking as well, and he represents Cintas. So I'm going to go ahead and hand it over to you guys if you're ready.
Hey everyone, I'm Elias Coury, as she said, project coordinator for Lloyd Creature Consulting, and today I'm going to go ahead and talk about infection prevention control, the past, present, and future. So a little bit more just so you know who we are, is we're a national company focused on mitigating the harms and lives lost from healthcare-associated infections in all healthcare settings. We do this through offering solutions for developing, implementing, and managing infection prevention programs, and then we provide some deep dive assessments to identify gaps in infection control practices, policies, and procedures, and also provide in-service training for infection control competency and other data surveillance and management tools. So some of our objectives for today is to understand the landscapes of infections in the outpatient setting, look at the need for a more robust infection control measures, find some solutions to implement evidence-based infection prevention and control practices, and environmental services to mitigate the risk of infections. So let's start with the past in mind. This is just a little comic strip that illustrates the growth of burden healthcare settings are facing. So you are the next class of the drug-resistant bacteria. As humans continue to abuse and overuse antibiotics, your ranks will swell. So go out there and mutate. And remember, that which does not kill us makes us stronger. I always kind of like that comment. It kind of just illustrates the burden that we're facing right now. So clearly our goal is to mitigate the spread of organisms such as this. As I'm sure all of you are aware, healthcare has been experiencing a shift. More and more we are seeing healthcare delivery transfer from acute care hospitals to ambulatory care settings. This shift, along with ongoing infection outbreaks and patient notification events, have demonstrated the need for greater understanding and implementation of evidence-based infection prevention and control practices. We have seen a growth of patient populations visiting clinics, ASCs, and physician offices. More than 3/4 of all operations that take place in the United States are now occurring in outpatient settings. More vulnerable populations are relying on frequent and intensive use of outpatient care to maintain and improve their health. An ambulatory care survey estimated that there was 883 million visits to various ambulatory medical centers, and that there were 202 million visits to general or family practices. With increased visits and patients receiving care in these various outpatient settings, the possibility for infection increases. There have been some significant outbreaks and patient notification events in recent years. From 1998 to 2014, more than 50 outbreaks of viral bacterial infections occurred. During 2001 and 2012, an estimated 150,000 patients received notification recommending they undergo bloodborne pathogen testing after they were potentially exposed to unsafe injections. One of the largest outbreaks occurred in an endoscopy center. It was linked to unsafe injection practices involving reusing syringes and then sharing single-use medication vials between patients. This resulted in over 50,000 people being identified for potential exposure to Hep C and 106 verified cases. I kind of want to give you a broader perspective here. Infection in the outpatient settings occur in all types of ambulatory settings. As you can see, infection control lapses occur in radiology clinics. So this one here, the healthcare personnel didn't wear a face mask when performing spinal injections, and this resulted in meningitis outbreak. And then up here, the physician's office, surveyors witnessed syringes being used on multiple patients. These are things that are huge lapses and can lead to major outbreaks and problems. So this is a state pilot study supported by CMS and the CDC. And really what it wanted to look at was hoping to understand more about the burden of infections and how these lapses were occurring. And what they found was that lapses were in the implementation of the infection control policies. So 2/3 of the facilities had lapses in their infection control programs. 19% of the facilities had lapses in their hand hygiene and PPE, 28% in injection safety and medication handling, 28% had issues in reprocessing. So these are the devices that are going into people's bodies, and there's lapses in the process of cleaning, disinfecting, and sterilizing these items. The largest lapses were with blood glucose monitoring equipment. 46% of the facilities observed demonstrated a lapse in protocol handling of this equipment. Next, I want to describe challenges that ambulatory care has faced with regard to infection control practices. So the scope of care being provided in an outpatient setting is pretty wide, and the complexity and volume of care keeps increasing as the years go on. One issue is the lack of evidence-based standards in surveillance and oversight. An example of this is a pediatric office in Colorado had an issue where a medical assistant who was tasked with administering influenza vaccinations was using half doses and then putting the remainder aside in a box labeled second dose. The assistant would then reuse the syringe when the children came back for the second injection. Other issues are in the design of the building, and many facilities don't have private rooms. So not that this is anyone's fault, but this means when patients with respiratory symptoms enter, they're in close proximity to others for prolonged periods of time, and most of the time they're in that proximity without being offered or instructed to wear a mask. Policies and knowledge are another issue. Policies and knowledge are not being transferred properly to practice. This leads to issues with infection control standards, such as the safe injection practices not being met, and can result in the outbreaks we've covered previously. Lastly, and what has been a personal challenge for some of the facilities that my company works with, is environmental services. We have seen that EVS staff often lack training in infection control measures. In addition, there's a less standardization in cleaning procedures, types of chemicals used, and established monitoring systems to assure that patient care equipment and the environment is being cleaned according to site-specific requirements. One of the things that we go in and do is an on-site assessment and further the education of the EVS procedures. We've observed all kinds of lapses. We've seen staff wear sandals to clean in with no PPE, which I know sounds crazy, inadequate glove use and hand hygiene, thereby contaminating the environment they're supposed to be cleaning, exam and procedure tables barely wiped or touched during cleaning and disinfection. I've seen inappropriate cleaning chemicals, and then even mopping with dirty water. These are some major issues that can lead to some serious harm. The first step to a good infection prevention and control program is understanding your state and federal requirements. Here's a map, and don't worry, I'm not about to go into some geography lesson. I just want to show this map because I think it's a really handy app that you can access on the internet. It gives you the phone numbers, the emails, and if they have a website, the website for your state departments and health departments. So while there are federal requirements, each state has their own regulations for infection control, and it's good to understand what you might want or might be specific to your state. So in addition to the regulations, you can also find which diseases are required to be reported in your state. So there is reportable disease at the national level, but then there's also going to be reportable diseases at the state level. This is the one from Arizona, just because that's where I'm out of, but they're all available on their websites. But if you're struggling to find the information, don't hesitate to call your health department and ask for support. They're there to assist you, and they can be a great resource. Of course, we're always here to help and support you as well if you need. So in addition to the state regulations, there are federal mandates that every state requires. First is every outpatient setting needs to have an established infection control program created under the direction of a qualified individual. So someone with training and knowledge of infection prevention and control, or someone that is like CIC certified. Next, the facility needs to have a method to identify and document infections occurring at the facility. Third, the facility needs to have established infection prevention and control policies and procedures. They need to have these documented and implemented to protect the health and safety of patients. It's also good to note that all facilities are required to understand OSHA standards of care. This includes regulations specific to bloodborne pathogens, hazard communication, ionizing radiation, and reporting of occupational injuries and illness. We have discussed some of the regulations for your programs and identified some lapses that could be occurring. So I want to take a look at solutions of how we can implement evidence-based infection prevention and control practices, environmental services that can mitigate the risk of infection. So one good tool is the Infection Control Assessment and Response Tool, or ICAR for short. This tool was developed to assist in assessing infection prevention practices and to guide the quality improvement of your organization. So within the ICAR, you have domains that measure the facility infection prevention program. You have demographics used to understand what kind of care you provide, infrastructure, which speaks to your policies and procedures, surveillance systems and trainings, and then direct observation. This identifies how your policies are translating into practice. The assessment includes observations of hand hygiene, injection safety, environmental cleaning, device reprocessing, and then I have the full list here on the right so you can read through them all, but I didn't want to spend too much time going through them. This can take some time to do, but it is a great way to identify areas that can be improved upon in your program. Next, I want to briefly describe some basic infection control principles to support your program. So first is hand hygiene. You want to make sure the staff knows the key opportunities for hand hygiene before touching a patient, before clean procedures, after body fluid exposure risk, after touching a patient, after touching a patient's surroundings that could be compromised. We want to ensure that the staff follow the proper way to wash their hands to reduce the risk of spreading pathogens. As I'm sure most of you know, when you use soap versus hand sanitizer, but you want to make sure that your staff also knows this, such as like using soap when your hands are visibly soiled or after caring for an individual with C. diff or norovirus. Next up is PPE. Verify that your facility has sufficient and appropriate PPE available and readily accessible. This includes gloves, gown, and mask. Verify the staff is properly educated on donning and doffing techniques. Sorry about that, donning and doffing techniques, including the environmental cleaning staff. So really what you want to be looking for here is donning gloves for potential contact with blood and bodily fluids, donning a gown during procedures or activities whenever there's blood and it's anticipated, and then donning a mask or face shield during procedures likely to generate splashes or sprays of body fluids. As indicated, a good number of lapses and outbreaks discussed were from improper injection safety. It is to your benefit to ensure that all of your staff responsible for injection practices understand and demonstrate competency of safe injection practices. So this is going to include aseptic technique when preparing and administering medications, not reusing syringes to enter medical vials or containers, and then making sure that whenever you dispose of a sharps needle, it goes into a correct sharps container, so the non-puncture and the lid can seal shut. Also, be sure that your single-dose vials are not used as multi-dose vials. We've seen that quite a bit, and that your multi-dose vials are labeled and then discarded after 28 days. And then your state should have recommendations on when multi-dose vials need to be discarded by. So APIC has an excellent safe injection practice position paper that I'm happy to provide for you, and it has the most up-to-date guidance for safe injection practices if anyone wants that. So another one is device reprocessing and sterilization. This includes the cleaning, disinfecting, and sterilizing of equipment. You want to verify that staff understands the classification of equipment, such as non-critical, semi-critical, and critical, and then the level of cleaning that's associated with each of those devices. Ensure that reprocessing responsibilities are assigned to an individual with appropriate training. This is one area we observe staff are grossly undereducated. In fact, in some outpatient centers, we are aware that the equipment, such as like an autoclave, has simply been dropped off with no proper training. And this is one area of the highest risk for infection, so it's needing appropriate training is essential. Environmental cleaning is huge. You want to make sure that your policies and procedures address and prompt appropriate cleaning and decontamination of spills. You want to verify that you're cleaning with an EPA registered product and that the staff are really using the manufacturer recommendations when preparing and using the chemicals. Sometimes they're on the chemicals, other times you might have to look them up. But you want to know things like how much dilution it needs to go and then the contact time. So you also want to verify that your EVS staff is trained in proper infection measures. Make sure that they're cleaning high to low in a clockwise or counterclockwise manner, and then from clean to dirty. There's some great videos in English and Spanish from the Oregon Patient Safety Commission, and that's the picture I have here for you in the link below. And not all of them are going to be specific to your setting, but the basics remain the same, and they're a really useful tool, especially for someone that's pretty new or doesn't have the background of a hospital. So we've discussed training and education a good amount, and this is because the job of infection prevention is always changing. This is why it is recommended that the facility provide task-specific infection prevention training to all staff. So you want to cover the basics and principles of patient safety. Training should take place upon hire, and then again annually, just for updates and everything that's going on. You want to act as like almost a refresher. And then anytime you update policies and procedures, you want to make sure that you're providing training to make adjustments for those new policies or new procedures. So one of the tools that we've created in LKC is for our partners is the company-based audit tool that helps track all aspects of infection prevention. So it's just, you can see the different ones here. We have safe injections, PPE, and hand hygiene, because you want to be sure that you're testing the competencies following any sort of training with your staff and make sure that they're doing these procedures properly. So for us, you can enter this in on your mobile phone, and then once you're done, you press submit, and then the data is automatically updated to our server, and we generate the dashboard here. It's real-time data that provides trends in compliance and allows improvements to be made and measured. So lastly, let's look toward the future of infection prevention and control in the outpatient setting. Healthy People is an initiative spearheaded by the Office of Disease Prevention and Health Promotion. The initiative creates goals of reducing HAIs in various healthcare settings, and then through partnerships with CDC, CMS, and other government agencies, establishes action plans to achieve those goals. Some of the goals for outpatient settings are to increase physician office visits by patients with diagnosis of cardiovascular disease and diabetes. They want that increased by 10%. Other goals are to have end-stage renal disease facilities reporting into NHSN, and they would like that to be around 90%. And then to reduce facility onset MRSA infections by 50%. So some pretty hefty goals, but they go about it in some different ways. I also left out that they do want vaccination rates to increase to about 90%. Most of the problems with vaccination is through policy and procedure, and there's some different things that you can do to encourage getting vaccinated. So qualitative goals that they have is they want to conduct more frequent surveys and have more structure to the process so that it can assess infection control practices. They'd like to increase education and then increase resources such as research and guidance for infection control, since it's been lacking in outpatient settings. What is really important is the new mandates from the Joint Commission to any accredited ambulatory care setting. So I wanted to go over these. And these are any settings that routinely prescribe antimicrobial medications. So as of this month, January 2020, you need to identify an antimicrobial stewardship leader. And then also establish an annual microbial stewardship goal, implement evidence-based practice guidelines related to antimicrobial stewardship goals, provide clinical staff with educational resources related to the antimicrobial stewardship goals, and then collect, analyze, and report data related to the antimicrobial stewardship goals. And that's all going to be starting to look for and required. I'll lastly touch on some new technologies that are pretty exciting always when they come out with something new. So we have some exciting new stuff coming out. Obviously, you've seen the UV lights, but it's really the no-touch approaches to room decontamination that's been popular. So the UV lights and then also self-disinfecting surfaces. And then I want to leave you off with some valuable resources. That way, when you're looking through things and you're trying to help your program, you can have some places to go and help you fill in gaps. So this is the first one, the Pocket Guide. It's just a quick reference that can be used for outpatient healthcare. It says that it's for oncology, but it's a great tool for all outpatient settings. The CDC guidelines for infection control and ambulatory care provides instructions and recommendations for various domains, and that can help you really dive deeper into your program. The third is a link for recommended vaccines for healthcare workers. So this site allows you to find your state requirements for healthcare personnel vaccinations and then be compliant. And lastly is a link to OSHA's bloodborne pathogen and needle stick page with guidance and education on best procedures to keep your patients and staff safe. So if you have any questions or need assistance, you can reach me at any of these here. This is my contact info or my company's contact info. And then I thank you very much for listening, and I'm going to pass it off to Adam here.
Great, thanks, Elias. Good morning, everyone. My name is Adam Deas, alongside with Valor Development. We're with Cintas Corporation. We work within our healthcare division, and we are a managed service provider. And within our roles, we focus solely on the post-acute or the non-acute space. So with the programs and the services that we provide, Elias, if you could flip to the next slide for me.
It's just 1 second. It's there we go.
Thank you. So we provide a number of services as a follow-up to Elias's presentation that can help take many programs and services off of your plate to give you time to focus on what's most important, which is providing quality patient care. There's been a white paper study that was provided or done earlier in 2019 centered around home laundering of scrubs or apparel within the healthcare space, along with microfiber or using the correct cleaning tools or products within the healthcare space. And as you can see here on this slide, our white paper study, the percentages of uniforms that were tested positive for MRSA that were being home laundered. And again, with Cintas, things that we could provide with not only scrubs and lab coats, but also the PPE that Elias was mentioning or alluding to during his presentation. Next slide for me, Elias. A little more on just our garment and uniform apparel, just to get away from maybe a surgical scrub look. This is our new EverFlex garment line, comes in a men's and a women's top. Next slide, Elias. Along with our lab coat, and do a little did you know on there, the average lab coat is worn 21 times before it is laundered. That's something to think about. Next slide, Elias. So Elias mentioned, spoke a few times on hand hygiene. So with the programs through Cintas, we have service reps that will come in and provide these products and manage inventory levels, refill dispensers on a weekly basis. We have a partnership with Germex to provide hand sanitizers in addition to hand soap, paper products to again just to help put time back in your calendar to focus on again what's most important. Next slide, Elias. Microfiber cleaning products. We have a partnership with Rubbermaid to provide these tools, along with the microfiber mops, towels, high dusters, mop sticks. All the programs will be provided and professionally laundered per CDC guidelines within our laundry facilities. Next slide, Elias. In addition to the microfiber, comes with the correct cleaning chemicals. So Cintas partnership through Diversity to provide properly diluted chemicals and the correct chemicals to utilize within the healthcare space to help clean and disinfect. And next slide. And that's all I have. Again, we are Cintas, Val, and Adam. We are here as a resource for you and a contracted supplier through PSMA. We appreciate the time and the opportunity to present this topic to you, and look forward to hearing from you soon. And I'll pass it back over to you, Meg.
Awesome. Thank you so much, Adam. And also thank you, Elias. That was very informational and helpful. I think it was really relevant to our members too. Also, I know for a fact that Cintas would love to talk to you guys. So I just wanted to remind you guys of that. Plus we get discounts, or you get discounts as PSMA members on Cintas products and services. So it's kind of a win-win. And if you guys are interested in that, you can either go to psmaconnect.com and connect to link with Cintas once you've signed in, or you could even just email me at vendors, that's VENDORS at psma.us, and I will put you in contact with the right people. Thank you guys so much for logging on, and have a wonderful day. Thanks, guys.